Houston Health Department is using social media to address concerns about the second dose of the vaccine. Apparently, some folks are nervous they won't get scheduled for the booster. The health department tweeted, quote, "The volume of calls about second doses is creating long wait times at the city's call center. Some may see that second dose as an opportunity to exhale because they're now fully vaccinated against COVID-19. Melissa Correa joins us from her home live. Mel, you tracked down women who received both shots. How do they feel physically and psychologically?
Well, Mia, their anxiety has definitely dropped, but both of these women experienced side effects, and they are now facing a whole lot of questions from their friends and family who are curious about the vaccine.
With minorities, especially Hispanic and African Americans, it's kind of like we have a skepticism of receiving vaccinations.
Which is why we're talking to Elena, a registered nurse here in Houston, and Renee, who's administering COVID-19 tests in the Rio Grande Valley. The healthcare workers just received their second dose of the Pfizer vaccine.
The arm soreness was a little bit more extreme than the flu shot.
The second dose, that one really hit me, and it hit me hard. I felt like I was getting all of the symptoms.
Body aches and chills. Both women say they took Tylenol to relieve their pain on the days they got their shots.
Do you regret getting the vaccine?
Not at all. I would rather feel cruddy for 24 hours than to experience, the full force of the COVID symptoms.
Will I feel totally safe? No, not until my entire family is vaccinated.
That's why Elena is sharing her experience. Writing on Facebook, after a week of declining the vaccine, she listened to a presentation and asked questions at a webinar. Sharing, there is always a fear whenever she puts unfamiliar medication into her body, but she weighed the risks.
Yeah, X-ray technician reached out to me yesterday because he was very afraid to get the vaccine. And after I talked to him, he did take the vaccination.
Renee socialized her husband's vaccine experience. He's a healthcare worker too.
I did get a lot of private messages from people that said, if you got it and it's okay, I feel comfortable now telling my family that it's okay for them to get it.
After a double dose of the vaccine, these women are feeling hopeful.
Because I want to go back to Italy. I want to travel. I want to do things that I missed, that me and my family missed.
Okay, you might be thinking, Elena received both doses of the vaccine. Why is she still wearing a face shield and a mask? That is actually one of the most popular questions posed to the CDC, and it's reporting there's just not enough information to say that we should stop those recommendations, those protocols after the vaccination process. Scientists still need to study the COVID-19 vaccines in real world conditions before they can make any recommendations. And doctors don't know if the vaccine actually keeps someone from spreading the virus. You could just become asymptomatic with the vaccine, but still spread it. So repeat after me, Houston. Even if you get both doses of the vaccine, wear a mask, stay 6 feet apart, avoid crowds, and wash your hands. Yeah,
that's right. With all the unknowns, Mel, it's still so very important to take all the precautions. Melissa Correa, thanks for reminding us all whether we're vaccinated or not.